In this lesson, we will discuss the various emergency equipment items, their location, and a brief explanation of their use. Halon fire extinguishers are located throughout the aircraft. The halon extinguishers are effective on all types of fires, but are primarily used on electrical, fuel, and grease fires. The extinguishers are equipped with a gauge to show bottle pressure, and a safety pin to prevent accidental discharge. To operate a halon extinguisher, pull the safety pin, aim at the base of the fire, and squeeze the trigger. Use a sweeping motion while moving toward the fire as the flame subsides. When discharged, the halon vaporizes and extinguishes the fire by chemically interrupting combustion. Do not discharge the fire extinguisher at close range to the fire, as the high-velocity stream may cause scattering of the burning material. Water fire extinguishers are located throughout the aircraft. Water fire extinguishers should be used on fabric or paper fires only. Do not use water fire extinguishers on electrical or grease fires. To operate a water extinguisher, rotate the handle clockwise to break the wire seal and puncture the CO2 cartridge. Aim the extinguisher at the base of the fire and squeeze the trigger. Use a sweeping motion and move toward the fire as the flame subsides. Do not discharge this fire extinguisher at close range to the fire, since the high-velocity stream may cause scattering of the burning material. Protective breathing equipment, or PBEs, provide protection from smoke and fumes while locating and extinguishing fires. PBEs are located throughout the aircraft. Each PBE is enclosed in a vacuum-sealed pouch inside a storage bracket. Each PBE has a smoke hood, neck seal, 2 oxygen supply cylinders, CO2 scrubbers, and timer-operated green and red indicator lights. To use a PBE, remove it from the pouch. Separate the oxygen cylinders to start the flow of oxygen into the smoke hood. Then open the seal as far as possible and don the PBE within 10 seconds of activating oxygen flow. As the hood inflates, the green light flashes. If the hood does not inflate, the PBE is not functioning properly and needs to be removed immediately. After donning, oxygen discharges into the PBE for approximately 7 to 8 minutes. After 7 to 8 minutes, oxygen flow stops, but the CO2 scrubbers will continue to provide a breathable atmosphere for an additional 7 to 8 minutes. As a result, the PBE provides a breathable atmosphere for approximately 15 minutes. A flashing red light or the hood collapsing indicates that the oxygen supply is depleted and the PBE must be discarded. During pre-flight, verify the tamper-evident seal is not broken and that the humidity indicator is blue. If the humidity indicator is any color other than blue, notify maintenance for a replacement. The aircraft is equipped with orange crew life vests and universal yellow passenger life vests. Flight crew life vests are located in the back of each of the captain's and first officer's seats. Flight attendants' life vests are located under each flight attendant seat. Passenger life vests are stored under each passenger seat. All passenger seat cushions are also approved flotation devices. Prior to departing the aircraft in a water emergency, don the life vest by first removing it from the pouch, then pull it over your head. After exiting the aircraft, the vest should be inflated by pulling down on the red inflation handles. Should one or both chambers fail to inflate, manually inflate the chambers by blowing into the red manual inflation tubes. All life vests have a water-activated battery that automatically illuminates a light on the side of the vest. An emergency evacuation slide raft is installed at the bottom of each passenger entry door. The slide raft design allows for use as an escape slide or a life raft. Opening the door from inside the cabin while the door is armed will automatically deploy and inflate the raft. If a raft fails to inflate automatically, manually inflate the slide using the red manual inflation handle in the bottom of the door frame. Once the aircraft is evacuated, manually detach the raft by lifting the Velcro flap at the bottom of the door frame and pulling the release handle. After the slide raft is detached from the fuselage, it is still connected to the aircraft by a single mooring line, designed to keep the raft from floating away. Once the survival raft is occupied, the mooring line must be cut with the knife located in a pouch on the raft. The aircraft has various medical equipment on board, including an emergency medical kit, first aid kits, and an automated external defibrillator. The emergency medical kit is designed to be used by a medical doctor or doctor of osteopathy to treat an ill person during flight. It contains items such as medicine, a stethoscope, protective gloves, and a blood pressure cuff. First aid kits provide aid for minor medical conditions. Typical first aid items such as bandages, adhesive tape, arm splints, and antiseptic swabs are provided. The automated external defibrillator, or AED, is used to re-establish a patient's heart rhythm in emergency situations. All aircraft are equipped with 3 emergency locator transmitters, 1 fuselage-mounted ELT, and 2 portable ELTs. The emergency locator transmitters transmit on 3 emergency frequencies, 121.5 MHz, 243.0 MHz, and 406 MHz. Each ELT has an operational battery life of at least 24 hours. The fuselage-mounted ELT can be activated from a switch on an overhead panel in the cockpit. The portable ELTs, located near doors 1 left and 4 right, have a control switch. With the control switch in the armed position, the ELT will automatically activate when placed in the water. The portable ELT can also be manually activated by moving the control switch to the on position. The aircraft is also equipped with the following emergency equipment: flashlights, a megaphone, and a crash axe.